Anger and aggression are two of the oldest recorded human traits, with references in ancient Greek and Roman writings. The Roman philosopher Seneca, in his essay on anger, stated, quote, "We are all here to encounter the most outrageous, brutal, dangerous, and intractable of all passions, the most loathsome and unmannerly, nay, the most ridiculous too. And the subduing of this monster will do a great deal toward the establishment of human peace." End quote. Christian scholars, such as St. Augustine, called anger dysfunctional and stressed the need to learn self-control. 2,000 plus years later, in the infamous Godfather movie, Don Corleone, the head of the crime family, told his son who would succeed him, quote, "Never hate your enemies. It affects your judgment." End quote. Charles Darwin's evolutionary theory attempted to explain anger as part of the instinctual nature of all animals. Sigmund Freud believed anger was a weak expression of aggression, yet part of a natural drive that resists autonomous control. Today, many researchers and practitioners in mental health fields believe anger is a secondary emotion, often associated with depression. And while anger is the emotion that frequently precedes aggression, the amount of research on anger is paltry compared to that of aggression, and that makes little sense. One might logically reason that if you can understand anger, then you might learn how to prevent, mitigate, or de-escalate it, and thereby avoid many instances of aggression. Yet, aggression has the stage when it comes to research. From 1971 to 2005, there were 1,081 journal articles related to assessment of depression, and 744 for anxiety, but a mere 74 examining anger. The research for treatment of anger is even poorer, with 6,356 articles examining treatment of depression and 2,516 articles on treatment of anxiety, yet a mere 185 reviewing treatment for anger. Why do researchers shy away from anger? It may be that the study of it is distasteful as well as difficult. Mental health professionals would probably rather treat depressed and anxious clients who are docile rather than angry ones who might become aggressive. Moreover, aggressive clients could become criminally violent. Anger might be a subject best left for criminologists and correctional psychologists. More likely, clinicians may view angry clients as resistant to treatment. Anger and aggression play out on a daily basis throughout the world, and one need only look at media, including social media, in any country to see how it is omnipresent from the micro individual level to the macro war level. Anger and aggression present their own laundry list of problems as well. They are associated with the disruption of personal and professional relationships, poor decision-making, increased risk-taking, long-term health and mental health problems that include heart disease and cancer. Today, anger is coming into its own right and is being recognized as a basic emotion to all human beings. Nevertheless, as late as 2000, the Mental Health Field's Diagnostic and Statistical Manual of Mental Disorders had not listed anger as a diagnostic category, even though there are 10 mood disorders and 12 categories of anxiety disorders, and some patients may meet the criteria for those disorders without experiencing or displaying anger. In addition to the relatively small amount of research on anger compared to aggression, There are few assessment tools to measure anger, and those that are used have questionable validity and do not all measure the same aspects of anger. Defining anger can be difficult. Synonyms often used include aggression, hostility, irritability, and even hate. Yet all of those terms are defined differently than anger. This lack of an accepted definition may be part of the reason the concept is difficult to study. Anger, however, is distinctly different than aggression. The former is an emotion. The latter is an action. The two might appear to be related, yet the connections and the theories that might explain them remain unclear.